name is Kiva Robinson and I'll be doing a health check on a lamb today. Health checks need to be carried out routinely to ensure you can pick up good and bad signs of health, to also allow you to carry out any preventative treatment if needed. This will allow the lamb to have an optimum life, which covers its welfare under the Animal Welfare Act 2006. These lambs are pet lambs. This means they are bottle fed, which allows them to be handled more. This will help when they're older for any restraint that is needed, for any medical care. Carrying out a health check, you need to make sure that all resources that you're going to be using are at hand and ready. You also need to make sure you have the correct PPE on. This includes overalls, steel toe cap boots, all jewellery removed, and long hair tied back like mine. This ensures that animal safety and my safety under the Personal Protective Equipment Act. Before starting the physical health check, you need to observe the animal in its enclosure without touching it to ensure you can see its locomotion, its general activity with others in the enclosure if housed with others, as well as its overall general health. The lamb I will be conducting the health check on. As you can see, it is the smallest in the pen. That does not affect its health at all. As you can see, it is walking around fine. Its tail's wagging, it's engaging with other lambs. I would say overall it has a good health. Handling an animal, you need to ensure you have the correct restraint. For a lamb at this size, the correct restraint is to hold its chest like that and under its stomach like that to ensure stability when handling. In a health check, you need to do it systematically, starting from the head to the rump of the lamb. This will help prevent transmission of diseases. To start off the health check, you want to look at the lamb's eyes. You need to look for cleanness, cloudiness, as well as alertness. For this lamb, it is quite alert when it's looking around. They're quite clear, however they do have a little bit of gunk in them, but this can show that the immune system is working, as well as the fact it lives with other lambs due to poor health. Next, you look at the lamb's mouth. You see if there's any lesions, abrasions or discharge coming out of it. This could be signs of poor health, but as you can see on this lamb, there doesn't seem to be any. Next, going into the mouth, you need to see if there's any lesions or abrasions also. You also need to try and see if they have their milk teeth, with, as you can see on this lamb, it does. It also has a palate on the top, which looks good. It is a little bit grey, but that could be due to lack of nutrition with not having a mother. Moving on to the nose, we will be looking for lesions, abrasions and discharge again. Also with the nose, you need to see how moist it is, because this will show signs of good health. This lamb has quite a moist nose, which is good. Moving on to the ears, you want to see if they're clean. This one does have a little bit gunk on the outside, but that is just feces or something off living in the enclosure. They do look quite clear. They are a good colour, which shows good signs of blood flow. This ear is also similar, pink with good blood flow. You can see there's no discharge coming out. Next we move on to the lamb's body, from the neck to the hips, to ensure that we don't go onto the rump and spread diseases. We look at the lamb overall health. It is looking quite good and it has quite a full belly, which shows that it is eating. We also then look at the lamb's wool and skin. Its skin is quite pink. It does have a little bit of muck on it, but that is just from the enclosure. Then we move on to the legs. They have got a little bit of muck on again, but they look quite good. All hoofs a little bit dirty, but that can just come out and be disposed of. You also look at the lamb's umbilical cord. As you can see, it's been dipped in iodine when born. This is drying up nicely. Doesn't look like it has any signs of infection in it. With this lamb also being a boy, you then look at the fact that it has been ring and tailed. You have to ensure that you don't get the lamb's teats in, but you do get the full scrotum and both testes inside. You then look onto the lamb's back legs to make sure they are doing full locomotion, clean, no lesions or abrasions. They are a little bit dirty, but that is just off the enclosure. As you can see, both legs move well. The hooves are looking good, a little bit dirty, no signs of infections or diseases in them. Same with this one also. Then we move on to the lamb's tail. This does have a rubber band around it, which will mean that the bottom of the tail will eventually drop off due to lack of blood flow. As you can see here, there's no signs of discharge or infection or any lesions or abrasions on the tail. Help prevent the lack of feces building up as well as fly strike when older. Then move on to the lamb's rectum. As you can see, it's quite clean. It does have a little bit of build up, but that is okay. There's no discharge, no lesions or abrasions. A disease to watch out for in sheep can be contagious ovine digital dermatitis. This is a bacteria isolated in infected hooves. When a sheep has cod, it usually has a co-infection with foot rot. The control of a foot rot should be able to help reduce the risk of cod. Contagious ovine digital dermatitis occurs at the top of the hoof at the coronary band and results in severe lameness. Early signs of infection are small ulcerated areas on the coronary band. The infection progresses to underrun the hood horn capsule downwards towards the toe. This could potentially cause the whole horn capsule to fall off. If there is a severe outbreak of cod, up to 50% of the flock, both adults and lambs, can be affected. Lambs can be set back from several weeks to up to several months if infected. If cod is suspected, seeking veterinary help is essential. Treatment options include long-acting antibiotics, antibiotic spray, which may require multiple treatments. However, you should never cut the hoof because there can be a risk of damage to underlying tissues and spread of infections on materials. To help prevent cod, you should buy in animals with a flock history that are free of cod, inspect feet of all animals returning or bought in, and many sheep that have early cod lesion signs are not lame and can introduce disease to your flock. You should also quarantine any purchased or returning stock for at least 28 days, longer if possible. You also need to clean your hands and disinfect any tools between feet. Contact time on any tools for disinfecting is essential. Research has shown that 1% FAM30, 2% Virkon or 2% sodium hypochlorite are all effective. Information about cod can be found on the AHDB website or on the NADIS website. Another disease to be aware about in lambs is coccidiosis. Coccidia are single-celled microscopic parasites that live and reproduce in animal cells. Almost all lambs will be affected in the early life with one or more types of coccidia. There is only 2 pathogenic species that will cause a clinical disease in lambs, when there is either a heavy infestation in the lamb or the lamb has lowered immunity. Lambs take in coccidia oocysts, which is the eggs, by mouth. Once they are inside the gut, the eggs hatch, invade the gut, and multiply rapidly. Coccidia can cause major damage in the lamb's guts by the cells bursting open. Coccidia eggs are very hardy and they can live for prolonged periods of time, even over winter. Clinical coccidiosis in the UK is mainly seen in lambs aged 4 to 8 weeks old, however it is not common in animals over 3 months old. Clinical signs may include straining, pain, weight loss and sometimes death. Stunted growth rates may appear after a lamb has had coccidiosis as the gut has a reduced ability to absorb nutrients from the food. Prevention methods include good biosecurity, hygiene and management. It is also good to have timed and targeted preventative treatment ready. As you cannot disinfect a field, rotational grazing is ideal to reduce the risk of lambs getting coccidiosis. Areas around the feeders can become heavily infected and should be moved daily. Information about coccidiosis can be found on the NADIS website. A third disease found in sheep is blue tongue. This is a notifiable disease that is spread by biting midges. It affects ruminants and camelids such as llamas and alpacas. Clinical signs of blue tongue in sheep include ulcers or sores of the mouth and nose, discharge from eyes, nose and drooling from the mouth, swelling of the lips, tongue, head and neck as well as the coronary band. They will have red skin, fever, lameness, breathing problems, abortion, fetal deformities and stillbirths as well as death. Lambs can become infected with blue tongue if the young was infected while going through parturition. This will include the lambs being born small, weak, deformed or blind. Other signs can be death of lambs within a few days of birth as well as stillbirths. Outbreaks can occur when susceptible sheep, particularly European breeds, are introduced to endemic areas or when the virus is introduced to a region by wind-borne movement of infected calicocides, which is biting midges. There is currently an outbreak of blue tongue in the UK which spreads from Exeter across the bottom of the UK and up the east coast to North Yorkshire. This means farmers should be on high alert and have very strong biosecurity measures. Information can be found on AHDB, gov.uk and the Animal and Plant Health Agency website.